and I tell you, so I just looked, and we have a handful of people on. I think we have actually 10 people on. So some of the people are adult children also who are coming to the conference. And I just want to thank you, like I said, for taking your time to do this, since we just connected with you. But I wonder if you could just tell us a little about you and then your research.
Sure. So my name is Dr. Jennifer Hogsdon, and I am a licensed marriage and family therapist, but my specialty is medical family therapy. So my research, my clinical work, a lot of my teaching is focused around helping families cope and manage with illness. And I have been at East Carolina University since 2000, but prior to that, and where my affinity for Parkinson's started was at Nova Southeastern University in Fort Lauderdale, Florida. Back in 1998, I had some students who were doing various clinical experiences, and they had an opportunity to work in a physical therapy clinic. And we happened to notice that there was a large number of patients in the clinic that had Parkinson's. And so another faculty member from Nova Southeastern in a different department that I was in, and I got together and we started a support group down there. And the group just did so well. And in 2 years' time, it morphed from a, open-ended, session-limited group with topics to one where we had graduates that just wanted to continue to meet and process and learn. And so I had gotten called to East Carolina University to start a doctoral program in medical family therapy, and they made me promise that wherever I went, I would continue to work with the Parkinson's community. So that was the deal I made for getting to leave. And that was the participants. So I honored that. And as soon as I could find the group here, and it took me a little while to find them, but I have been involved with that support group since 2001. And I just, I don't have personal experience with Parkinson's in my family, but I have great respect for the families that are managing Parkinson's. They're some of the strongest families I know, some of the strongest marriages I've ever had the opportunity or privilege to meet. I always tell people, I work for the Parkinson's group, so I help facilitate, the organization of it and bring speakers, but truly, just really wanting to give them whatever they need in order to make things easier for them. So we have a support group that we get from 40, about 20 to 40 people come. We'll get a lot of family members, and occasionally some adult children will come. And that's really such a blessing when they do, because it really demonstrates to the patient and the caregiver that they're not alone. And a lot of the caregivers are spouses. So, we really have an opportunity that we have decided makes a difference, and that is twice, I think, in semesters because of academia, but twice a year, once each semester, we have what's called a process group. And this, we separate out the caregivers and the patients. And depending on how many patients we have, we may separate out early onset, early stage, later stage Parkinson's. But it gives them a chance to debrief and process with each other in a very open and honest and strength-based way. One of the things that we're really passionate about with our group is that we focus a lot on the realities of Parkinson's, but in a strength-based way. So we try to keep the group as positive and uplifting as possible. And I think that that's why our group has stayed around for so long. And even though it can be a little overwhelming for new people coming in, and sometimes the family will come in and not the patients because it's just hard for them. I think they still, find that bringing together a community of people who understand what they're going through is such a helpful thing. So my involvement has been through facilitating that group, through doing some research in that area. And then as a licensed marriage and family therapist, I've had the privilege to also walk with some families through their illness. So, that's a little bit about my background and my passion for the population.
Wow, that, I think we can share it. We shared that experience with the different levels of engagement and the different kinds of interaction with the different parts of the whole family system. And we certainly share your perspective that it's a system disease. It's not a one-person disease. And I think our greatest challenge is trying to figure out how to engage, the system more wholly to support each other. And that's what kind of inspired me with reading your research. I don't know if you want to share a little bit about what you've learned in your research.
Sure. So we had this opportunity to do a study where we invited the adult children of some of the families that we had gotten the opportunity to know in our community who are touched by Parkinson's. And we did what's called a qualitative study. So it's an interview-based study. Qualitative research allows us to go really in depth into the real rich narratives and stories so that we can learn beyond what a brief survey would ask. Getting details and examples. And what this does is it also invites us to find different ways to explore, in the research, things that we may not have considered because of our own limitations as researchers to really understand what the issues are. So when there is a gap in the literature, qualitative research oftentimes is a great entry point into fleshing out what are the stories, what are the issues, what are the strengths, and then developing surveys and instruments to see if those things are also shared more nationally, globally, with other people. So the population that we surveyed, there was 10, but the richness of the interviews told a very good story that I think has been very validating for a lot of people that have heard about it and read it. So we did the interviews. We looked at the fact that what we know about Parkinson's and what we know about chronic illness in general is that it tends to reorganize family systems in very interesting ways. Every family will respond to trauma or new information or change differently. It can bring families closer together. It can push families farther apart. Every family has its own method of managing. And some family members rise to a caregiving role and others choose pieces of that caregiving role that they feel like they can manage. So I think the study allowed us to sort of tap into some of those unique bonds, unique relationships, unique responses to really help validate that there's many different ways to adjust to Parkinson's in the family, and that adult children oftentimes are doing the very best they can. And we can provide more support based on those experiences. We also know that the parent-child bond, as we had discovered, is one of the most enduring bonds that there is. And so even if it was a tumultuous bond, if it was, there was some time where there wasn't as close of a relationship, somehow illness has a way of reminding us how precious time is. And it invites an opportunity to step in and for some healing to take place. And so that also has been a gift that I think some of our Parkinson's interviewees had commented on. But I'll go through some of the results more methodically. So we did these interviews. They each lasted, I think it was up to about an hour. And it was very interesting. The participants were a variety of different ages. Oh, actually, it was 7 participants. I was thinking of the other study I did, there was 10 couples. This was 7 adult children. But they fell in the age range of 20 to 30, and then there was another segment, 2 of them were 20 to 30, and 4 of them were 31 to 40, and 1 was over the age of 50. So you can see that they're all touched by different life experiences at that point, some not having families of their own, some having very young families, and then some having raised their families. It was pretty evenly split, 4 male, 3 female, all earning more than $30,000 annually, most earning more than about $50,000 annually. So a little bit more resource than maybe some of our other families would have that we serve. we kind of asked them if they could stage Parkinson's for us. And so, with the scale, the Hoehn-Yahr scale being from 1 to 5, with lowest to highest in severity, one participant found his parent patient to be about stage 2, 3 were in about stage 3, one was in stage 4, and one was in stage 5. And I think that's relevant because the challenges can change. It doesn't necessarily make it easier in the lower stages when their severity isn't there. And actually, I think some of the struggles can be even harder. It can be hard to get disability. It can be hard to get your employer to understand. It can be hard to get your children to understand when they can't really see it as much. But it represented a variety of stages. So we did the analysis. We read through all of the transcripts thoroughly. We coded them all thoroughly, and we came up with a series of themes. And I'm going to kind of go through each of them real briefly, and we can talk about them more. So the first theme was family system. And you mentioned system just a little while ago, that Parkinson's really does touch the whole system. And so what the adult children found is that, again, it either drew their family closer together, or it could have led the relationships to grow apart. Sometimes it could be disagreements in the way Parkinson's is being managed. Sometimes it's a protective mechanism to move away from somebody that's sick because you don't know what to say, you don't want to hurt their feelings, you don't want to do the wrong thing, or you want to keep them in mind of how you want to see them. So it's not always a response that people understand unless you've really been in it, and you can say, okay, I get why somebody would step back from their parent system, because they're scared, or it's out of respect, or they don't know how to help. Whereas some family systems, the adult children may move in and towards. This can be a beautiful thing to have relationships that may have been a little strained that now are closer together. So there's some amazing things that Parkinson's can do for sibling relationships and for parent-child relationships as well. The adult children also talked about role reversals that, in the family system. So the patient with Parkinson's may have been the breadwinner, or the one that everybody always went to for caregiving, the one who organized families around issues and illnesses. And so now maybe they're the one in need, and that can be hard. It can be hard for the patient to accept the help. It could be hard for the caregiver to share the load. Sometimes spouses feel like they have to do it all, and the children want to help, but the spouses or the partners aren't able to let go of it. So it really does change family systems. We had, one adult child described having hero worship for her parent, and that made it really difficult to see this patient, to see the parent as struggling with an illness. They were always the ones that were strong and providing and, stable and, held the family up, and now needing to see them as vulnerable and human. And that was very difficult for this adult child. They also talked about, the adult children, about how it improved their own relationships with their children. They held them closer. They told them they loved them more. They felt like time was more precious. And if you've ever lost somebody in your family, it changes. It changes the way you think about time and the things that we worry about and struggle, and how insignificant some of those things can be when you're facing something, that potentially can shorten the amount of time that you have with somebody that you love. So for the adult children, they oftentimes said it strengthened their own relationships with their partners and their children. And I have seen that in my role as a support group leader. I have seen that these families, they just have a sense of priority that's different than other families that I work with. They just have an appreciation for the moment. They have a thirst for life. A lot of times our Parkinson's members, when they're having a good day, they will go out and do everything they possibly can and wear themselves out for the next 3 days. but they wouldn't have it any other way. And, the adult kids are like, why are you doing so much, mom or dad? And I understand it, because when you're having a good day, you might suffer for it, but you want to be able to, get on the ground with your grandchildren, or, run out and do things, go to lunch with friends, and so, it's really interesting to watch how those relationships in the family systems, the role reversals, the opportunities for growth happen. The positive influence that Parkinson's can have is another aspect that we had learned from the study, which I think if you've worked with people who struggled with chronic illnesses, finding a way to make meaning out of it, whether it's spiritually based or other, is a really critical component to managing the meantime of it. And a lot of times they are able to find positives, whether at least it's not something else, another burden I have to carry. It's the opportunity to become closer together, the opportunities to see things more positively. So it was really a unique finding in the sense that a lot of the adult children said that it really helped them to have a hopeful perspective on something that probably didn't feel very hopeful when it first came to being known. One said, I've learned to try as much as possible when we're all together just to be positive. Even though it's a Parkinson's, a bad thing, I tried to turn it from a negative for him, the parent, to something that's really positive. I don't think you have anything to gain by thinking negatively or in a fatalistic way. I live one day at a time and stay positive. So, and those were some of the quotes from our participants. And that's truly something I hear quite a bit, is that quest to stay positive. Another theme is about providing care. And this was interesting, is there was a lot of respect paid. Most of our participants had a partner. There was a lot of respect paid in how their partners were willing to step forward and be a part of it. So for some of them, they couldn't leave work, so the partner would go and check on the parent, or take them to the doctors, or sort their medicines for them, or help them with their exercises. So that was really something that they talked about, is it wasn't so much how Parkinson's affected them as adult child, but the appreciation they had for having the spouse involved in helping to provide care. So that was truly something that they punctuated. A lot of the adult children reported tasks that they did to help, emotional tasks, physical tasks, financial tasks, household decision-making, social support. Not all the participants didn't perceive caregiving as a burden, although they did discuss some barriers, and one of the biggest barriers was geographical distance. So I think there was a few that said they moved closer to the parent. There was a few that said the parent moved closer to them, but some of them just had to manage that geographical distance and the challenges that came with providing care at a distance. Sometimes the adult child that lived closer did more of the physical caregiving, doctor's appointments, and the ones that were further away took on the financial, some of the emotional with phone calls. And so the children sort of would talk and figure out, like, how do we do respite? How do we manage these relationships? And how do we stay good with each other? Which I think is important, that, the adult children maintain contact with each other and are able to be free to say, hey, this is getting hard. Can you help? Or I know I'm the one who lives closest, but I need to be able to go do this trip for work, or I'm struggling with my own depression, I need some help, and having the other kids help. So I think that providing care aspect was a big theme, and then working on it with each other as siblings was something that they mentioned. Let me think. The female participants believed they were more involved by nature of being a woman, and so that is interesting, and I haven't explored that further in additional research, but the unique aspect of being a female in the family system, and then when the illness comes into the family, whether you're the partner of the adult child or whether you're the female adult child. It seemed in our study, at least, they felt a little more expectation to be more involved in the caregiving. And the men in it really appreciated it. I mean, they did acknowledge the women and how they seemed to be taking on more of that role. And one even punctuated that. He was a little bit older of an adult child too, and so probably had more traditional role with his wife, but really punctuated an appreciation for that. So I think that that was an important thing to say for that person. Some of them talked about, another theme was future thinking. So really the adult child is watching the moment but thinking of the future. What's going to happen when mom or dad can't ambulate as easily, can't communicate as easily? When do we start involving speech therapy, occupational therapy, physical therapy, mental health care? When do we need to start adapting their homes? When do we have to deal with driving? You know, that's a big one. When do I need to start going with them to the doctor's visits? You know, a lot of them talked about the challenges of even, you know, watching their parents struggle, but knowing that with some things like putting on socks and shoes or getting out the door, you know, they had to learn to be patient and they had to learn to not take over for the parent because maintaining independence as long as possible is really critical and important. And so they acknowledged that as well. And again, they talked about valuing their relationships with their own children and thinking about how important it is to put good time into those relationships because someday we may need that care from our children ourselves. And so they found value in realizing that if you want to draw from that relationship, you need to invest in it. And so I think that that was something else that came forward. And genuinely fear. I mean, I think that they also mentioned fear with what was going to happen and how or if they were going to be able to handle it. Another theme was Parkinson's progression. They described how difficult it was for them to watch their parent struggle with some of the symptoms. And so particularly anxiety, depression, frustration, lack of sleep, slowness in thought, slowness in speech or movement, some cognitive deterioration, just the overall progression of the disease. And talking about that and realizing how, you know, difficult it was to watch and wanting to be hopeful, but at the same time, seeing the realities of it. They observed ways that their loved one was limited in their ability to participate in family activities. And so they had to think differently about taking vacations or expectations during holidays, you know, traveling to children's events, things like that, that the person may have normally done before, but they could see changes were taking place and needing to grieve those changes as well. Another adult child talked about the biggest influence has been not being able to communicate with their parent as easily. Some of them talked about specifically how hard it is on the phone. So as, you know, the Parkinson's progresses and softer speech, and it becomes a little more difficult to have phone conversations. And so even though speech therapists can help, and we have the you know, therapies now that help them to project a little bit better, that was one of the things that the adult children talked about as being challenging. For many of the participants, the parent oftentimes, again, held a position of power within his or her employment and the family, and helping that parent grieve that loss of role as the disease progressed. And that's one thing, you know, I think about with the support group is some of our members, they were very well-respected physicians, attorneys, teachers, leaders in their community, farmers, you know, and they ran, you know, very important businesses. So, you know, it was a lot for them to have people step in and care for them and help them. And it was a lot for the people who loved them to have to do that. So that progression really force these adult children and their families to navigate all of these biopsychosocial spiritual changes together. Coping
Hey,
methods.
Jennifer.
Oh yeah, go ahead. Go ahead.
A quick question about that. I'm wondering, because I mean, you know, there's the typical aging parent challenges that people have.
Right.
And I'm intrigued. I actually didn't know there were medical marriage and family counselors, so, which makes perfect sense. So clearly having this kind of disease, there's the typical adult child, but then there's this, which is a different, I mean, I feel like that's some of the flavors you're talking about.
Absolutely. Well, right, because you not only have, well, and it depends on where you're at in the lifespan too. And a couple of our participants had talked about that. If you're one of the younger adult children, you don't really have a peer group for this. You know, this isn't how you imagine things happening in your family. And so, you know, the younger the onset of Parkinson's for the parent, you know, obviously the younger the child, and then navigating that. And then as they get older, where Parkinson's typically happens at age 65 or older, it can be difficult to diagnose because some of the changes can be changes that you would expect to see as one ages too. So it can be a little trickier for the diagnosis process to happen, and then to tease out what's typical aging and what's Parkinson's progression. Until it gets to the later stages, that can be really difficult. And it's also difficult for the spouse caregiver, because I think of one example of a couple that I worked with in the group. They were funny. They would try to use old communication patterns in the home by yelling to each other from room to room. Well, as they got older, they had to have a rule that, you know, you had to be in front of each other in order to make a request or ask, because they would get so angry, you know, like, why aren't you listening to me? Because I can't hear you. You know, it had nothing to do with Parkinson's. It had everything to, well, with the projection of the voice of one, but even so, the other's hearing was starting to go. And so they were able to laugh a little bit about it, but then learning to adapt with those typical aging challenges. And also the lifting. So, you know, one thing that was really, we had one participant that has since passed, and her husband had talked about as he aged, it got more difficult for him to lift her and to help her. And he was terrified of dropping her or falling with her. And so that challenge, and then the reality they had to face as far as when to involve more caregiving in the home or transition into an assisted living caregiving situation. So I think those typical development patterns, as well as Parkinson's, can make it a little more complicated. I hope is that what you were asking about?
Yeah, that is what I'm asking about. Like, I'm thinking of, you know, it struck me when you were talking about anxiety, actually.
Yes.
And two things struck me. One is seeing, you know, so there's typical aging, but that doesn't necessarily have that kind of anxiety, the anxiety and apathy and depression that is part of Parkinson's.
Right.
That is, I think, for adult children, like, you don't know what to do with that.
Right. Well, and a lot of it is the dopamine, you know, and I think we, you know, with the mood, your brain is not able to regulate mood as easily. And so it's difficult. You know, I have a parent with diabetes, and so sometimes it's hard for me to know, is this the diabetes, or is this just, you know, the parent dealing with other challenges? And so there is a whole nother level, plus some of the medications they take can cause symptoms, hallucinations, other things that come, you know, with trying to solve the problem, we create another one. And so then there's more medicine to manage that. And it is very difficult. And like I said, some of these parents, they were the pillars of strength. They never, you know, struggled with things. And now we're struggling. And it was hard for the adult children to know what to do with dad's anxiety. He's never been afraid to go out of the house. He's never been afraid or sad. I've never seen him cry. And so seeing these sort of mood states and knowing how to manage those, and I think it was incredibly difficult sometimes for the adult children. So, and
yeah,
we know
that makes sense.
Yeah, we know that therapy can help. Community, Parkinson's support group communities can help. Medication can help. Spiritual coping methods can help. So it's a variety of things that can really help, but some of this comes with the progression of the disease, and so it doesn't make it any easier, but at least now we know there's some things we can do to help mediate it a little bit.
Right.
And that's a perfect segue into different coping methods, because everybody copes differently. We have people in the group who cope by having fundraisers. We have people in the group who cope by not talking about it. We have people in the group who cope by having their parents, move in with them. It's a very spiritual, oriented approach. And so I think the value is trying to find things that adult children can plug into that allow them to progress emotionally, spiritually, physically, financially, along with the parent. And that's why I think support groups are so important and helpful, is because they provide those mechanisms for giving that information when needed. So I think they value those educational opportunities, much like this conference that you're having, because they want to know how they can be helpful. And then how can they manage their own emotional feelings on top of it. And if you've ever watched somebody struggle with an illness, there's the way you are in front of them, and there's the way you are in the privacy of your own space, and being able to validate that. So I think having those places, those relationships, those conferences, they said, is all very helpful. Contextually, they talked about various contextual factors that influence their experience. Again, reference to the parents' ages, their stage in life, their own age and stage in life, geographic location, their roles in their family, their gender, their career. Adult children ages 30 and older, so they draw strength from other adult children with aging parents, because even though their parent may not have Parkinson's, they might have, some sort of heart disease or arthritis or something that they can understand needing to kind of help the parent out a little more. But some of our younger, age 29 and youngers, can really have that same kind of support among their peers. And so they talked about how it felt a little more isolating and challenging. And that's interesting, because I have seen some of the younger adults come to support group. So I think they really do look for those examples of strength from other people. So, but yeah, the context means everything. Again, it can be, if the financial context too is being able to have resources. Some of our families have very limited means. So it's difficult for them. They can't get some of the therapies, or it's harder to get some of the therapies that they read about, or that they'd like to be able to expose their parent to, or they don't necessarily get told of these things, depending on, the person that they go and see. If they have the privilege of being able to drive to like a center of excellence, which for us is Duke, and so Greenville, North Carolina is situated about 2 hours away. So they have to traverse some busy freeway systems to get there. And for some of our older adults, driving long distances, navigating new roads, freeway systems is a little scary. So, they don't feel like maybe they're getting the best care or the most up-to-date care. So we try to bring speakers in to sort of relax that for them, that our local neurologists are informed, they're providing the best treatments. A lot of the adult children also worry that is their parent getting the most leading up to date information. And so, I think that that's an anxiety that some of our rural populations may have, or those that aren't located near centers of excellence, is just not knowing, does my neurologist know as much as they need to know? And how would I know that? How would I know I'm getting the best care? And so we'll hear that a lot from adult children too, is, are they doing enough? And we try to reassure them of that. So that's a little bit about the findings. And, with qualitative research, it's not generalizable to everybody. We sort of say, if something in that fits for you as a consumer, then that's great. And we hope that people will sort of take that and transform that into educational experiences and support groups or additional research. But most just giving voice to the adult children who are oftentimes, you know, the support system underneath, you know, the parent system. So I don't know if you have any other questions.
Well, I also want to open it up in case anybody else has any questions. You could either just unmute yourself, because we have a small group, so you could unmute yourself to ask questions, or you could use the chat at the bottom if you want. Either way, while we have this expert here with us. So I have a quick question while people are thinking about things. One of our greatest challenges actually in reaching out about this conference has been, and I will completely own that I did not anticipate it. As an adult child, I just thought, of course you're going to know your kids want to know about this. Not necessarily true. And so finding the various reasons, I mean, anything from I don't want to be a burden to my child, to I don't want my child to know that I need this help, to I don't want my child interfering with my life. I mean, all different reasons.
Yep.
Our connections tend to be with the people with Parkinson's and the care partners, and the adult children. That peripheral system is not something that we have access to easily to share this information. And so getting the people with Parkinson's or care partners to actually even tell their kids about the conference has been an interesting challenge. I guess I'm curious on your thoughts on that, and if you have any ideas, because what we found is when they do tell their kids, we will hear from their kids probably within 24 hours. You know, either they register for the conference or they say, I can't make it, what else can I do? You know?
Yeah, I do think it's a preventative thing. I have heard our members talk about that. And even in a former study I had done with couples, they try to protect their children as long as possible. They feel like they have busy lives. They're trying to raise their own families. They don't want to be a burden. And that may be a cultural as much as their own experience of their parents and not wanting to have to, you know, interrupt, you know, their children's lives. But oftentimes you do hear from the adult children that they want to be involved, and I think it's important that they're involved early on. That way they can grow with the changes instead of, you know, when it gets so severe and they have to catch up emotionally and mentally and financially and, you know, socially with all of the change that's happened. And so it can be very helpful for the group member or for the adult parent to allow the children to come in at the earlier stages of Parkinson's, so they have the opportunity to grow with them in their understanding and knowledge of the illness. And so I think it's how we frame it. I also know that we probably need to be reaching out through social media more broadly than just through the Parkinson's patients or members themselves. And that might be another way to promote it, instead of, you know, directly through the patients, but rather just through social media, through relationships. It's amazing how well recruitment can go with Facebook and Twitter and all of that. And that might be another strategy. And they do check websites a lot. I have learned, because I have gotten lots of phone calls from adult children who found websites, and they visit the websites a lot, and they try to learn as much as they can once they find out. And so I don't know how we can get some of the websites to help us, you know, when I think about the different foundations, National Parkins, Michael J. Fox, all of those, to help us promote things like this a little bit better for adult children and reach out, because they will visit those places. I see somebody else is on this.
Very good. Yep. I think Judy, did you have something?
Yeah, I was going to say, I think part of the thing with the parents is that, you know, doesn't necessarily even have to do with PD. It has to do with being an aging adult.
Yes.
And I'm speaking both from my professional knowledge and personally too, that parents have fulfilled the role of being the one in charge, the strong one, the capable one with their adult children. And I remember at like age 25 realizing that when you got growing up, things didn't just automatically change in your family relationships, that you were still throughout your lives going to have this parent-child relationship.
Yep.
And it may look more peer-like, especially if things are going well. But underneath that, the emotional basis is a parent-child relationship. And the parent, I think you were talking, Sarah, about them not telling their kids, and that doesn't surprise me. It hasn't all along that they would resist it, because essentially what they're saying when they talk about something like that is, hey, I'm vulnerable. Hey, I'm not as strong as you think I am. You know, I'm not going to get any stronger. Things, you know, I'm going to be more vulnerable to how you feel about me, and whether, you know, you're going to reject me because I'm sick now, or, you know, you're going to stand by me. And there's a tremendous vulnerability, and part of it is simply with people getting older when they become less capable and they feel that lack of capability in relationship to their children. The other thing that happens, and is really well shown in studies, is the kind of priming effect of older adults. You know, what people talk about, for example, with memory. Older adults tend to be really stressed out on memory tests, even when their memory's okay, because they've been primed to think they don't have good memories. So a whole lot of priming occurs in all of our cultures with this huge stereotype, it's worldwide, of what it is to be older. And the stereotype involves being less competent. So I think there are some really deep issues there, you know, that children don't see. But the adult does, and so that's what we're coming up against, is that kind of resistance that we'll need to overcome in future.
That's a great point. And thank you for sharing that. I think that's an excellent point. Yeah, I can see that, and I can also, we've also had some that were caregivers for their adult children. So then there's that level of complexity on top of that as well, where, you know, it's hard for them to ask for help because then they're already helping an adult child and they don't want people to think that they can't manage that. And you're right, it can be very complicated asking for help. Anything else that anybody has?
Let's see, just checking in to make sure nobody else has unmuted themselves.
I have a question. This is Beth.
I feel like
My question is related to how do you deal with grandchildren?
How do you deal with grandchildren?
Yeah.
Oh, so one of my favorite members, she was an accomplished, she has since passed, and she was a founding member of the group, but she was an exquisite organist. And when Parkinson's came into her life, it took away her ability to play. And so she found, and I don't know if any of you have had this experience, that she lost that ability, but she discovered what an amazing painter she was. And whenever she would paint, she did watercolors, she didn't have her tremor. And so she connected with her grandchildren through painting. And it was just beautiful. And she talked about how she had these ideas that she was going to teach them how to play the piano and she was going to do all these things, and then Parkinson's came in, and then she found this other ability. And, you know, I think some of our Parkinson's members have waited until the grandchildren ask questions. Some of them have gradually shared details about, you know, their illness. Some of the grandchildren have wanted to assist and help and have come to the group. We have had some grandchildren that have been involved. So I think that there's a variety of ways that they can engage grandchildren into it. A lot of it has to do with the parents as well and their comfort in discussing and talking about it. I don't know. I haven't explored books, but if there's a lot of great books out there on talking with your grandchildren about Parkinson's, but I think those books are always a way that I encourage people to do it as well with other diseases and illnesses that I've worked with.
There's one really good book out there that I know that we've used with grandchildren, and that was written by Muhammad Ali's daughter.
Oh,
that one is a very good book of explaining Parkinson's to grandchildren.
That's good. And I am going to take that with me. I'll print that off and take that with me on Sunday, just in case anybody wants to know about it. But
it's wonderful because it's very succinct, but it also explains why grandpops get stuck in the middle of a doorway.
Exactly. Or why he takes medicine, Absolutely. No, I think and again, I'm all for open communication in families. But with children, I encourage people to only give information as the children ask for details, because I think sometimes we can overwhelm them with details and they handle things in smaller pieces.
Yeah.
Same for lots of things that we'll talk to children about, when it comes to different, things they'll encounter in their lives. So we just open up with open-ended questions and then let the children ask. So I think those are helpful. And it's interesting, when I've watched grandparents talk to grandchildren about it, I see the adult children listening very carefully. So they're able to learn through their children, for their own children's curiosity, they're able to learn through that. So that's very helpful, because a lot of times the adult children are afraid to ask about it or want to know a lot. They don't want to offend or hurt. But, each patient's experience is different. They could read as much as they can on the internet or in books, but each person's experience and how they explain it's unique. So you can learn through the grandchildren, which is really neat. Thanks for the book idea.
That's a really great question. I think we have a couple grandchildren coming to the conference, and you're right. I mean, they're all part of the system. So somebody wondered, Beth, what was the name of the book that you recommended or you referenced?
Oh, my daughter-in-law has it right now, but it's Muhammad Ali's daughter wrote a book about Parkinson's and grandparents. I think it's like My Grandmom Has Parkinson's or something like that. I can't remember it now.
That's great.
Great. Okay. Thank you for that. This has been such a great conversation. I'm so grateful for you taking the time to talk with us today. You just sharing your insight. And I think one of the most encouraging things is it's great that somebody's even looking into this, because I think it is that unseen, underserved population that's pretty important to making the whole system, to helping the whole system work well. So I'm grateful that you've done the research.
Well, I really appreciate this. And I was so impressed to see this conference. I really am serious about trying to find a way that we can help the support groups across the country to sort of plug into something like this. Because I do think it will open up some healing conversations and validate a lot of things and give great suggestions and ideas. And, a lot of times we just feel stuck because we don't know what to do or how to do it or how to open up the conversation. So I think what you're all doing is remarkable. And I really am curious to hear how it goes and how we can maybe use it on a more national basis. So thank you for inviting me to even reconnect with this research. I appreciate the opportunity.
Well, I will circle back with you about how we might be able to do a little pilot with some of that with your group members. And then there's also just a few people who've most recently contacted us from out of state who haven't figured out how they could get to this. So you've inspired me to think about how we might do a little pilot, because we are all about that, and it seems that you are too. So it might be really nice to kind of put our heads together on that. And somebody says, Margie says, the title of the book is "I'll Hold Your Hand So You Won't Fall: A Child Guide to Parkinson's Disease." Thank you, Margie.
How can you find other medical family therapists in Arizona? Great question. So we have people all across the country, and it's a newer field, but I know that I've got, I want to say C.R. Mackey. I think he's at Arizona State University. I know there's that. He's out there in Arizona. So I'm trying to see, let me do some thinking on who else I might know out in that area. Funny thing is, Arizona is one of the states I've never visited. So I was like, this is just great to get to know people. Maybe it'll find me a reason to come to Arizona at some point.
Absolutely.
Yeah. I won't bring the humid heat, though. I promise.
Yeah. You don't want to come during the summer. You want to come visit us like in January or maybe in like March.
Let's do that. That would be great. I would love to come out to Arizona, but I'll do some thinking on others. But I think C.R. Mackey would be the one person that I know of that's got background. And the reason why medical family therapy is, if you think of mental health as an umbrella, so you have psychiatry, psychology, social work, counseling, marriage and family therapy, pastoral counseling, they're all sort of spokes of the umbrella. And family therapists and medical family therapists really focus on systemic change, and they have unique theories that go with that. And so I really love applying family therapy concepts to illnesses because it's truly a systems issue. And but the medical family therapists are those that really look at things biopsychosocially and spiritually. So I think it's really been, we're the first doctoral program in the country. Now there's others that have come out. So, it's really a newer area, but we're starting to identify more people nationally. So just get in touch with me if you need more references, and I can help you out that way. So
sounds good. I see Judy wrote in, and we'll connect back with you about that for other places around the country. I know you need to head out, and thank you so much for taking your time with us today.